Well, hello, ladies and gentlemen, and welcome to the latest in our series of Meet the Experts webinars. My name is Julia Priestley, and I'm one of the joint CEOs of the BTF. We've been running these meetings since the middle of 2020 and really believe that they've become an excellent way to connect individuals and families with the experts who can help them better understand how the thyroid works, what can happen when it doesn't work, and what possibly can be done about it. Today's meeting isn't about a specific thyroid disorder, like most of our previous webinars. There are sadly many unpleasant symptoms that patients have to put up with, and some are more specific to particular conditions, but the ones which sometimes seem to present the biggest challenge is weight and how to manage it in a healthy way. Why is it that it seems to be harder for people with a thyroid disorder to lose weight, and why do they seem to gain weight more easily even when their thyroid levels are under control? And if this is the case, why isn't there more dedicated support for the thyroid community? Well, to help us understand more about the questions we have, I'm really delighted to introduce you to our three expert speakers tonight, who all have years of experience of working with patients who'd like to better manage their weight. And it's important to remember as well, for some people, it's not all about the weight, it's just about wanting to feel better about themselves. So first of all, Dr. Christine Bollaert is a consultant endocrinologist and professor of endocrinology at the University of Birmingham. Christine also has a wide range of research interests, including in pregnancy and thyroid disease, and hyperthyroidism and weight gain. Next, we'll have Dr. Sue Jackson. Sue is a chartered psychologist. She's an associate lecturer at the University of Plymouth, and she also works in private practice. Sue has worked with pituitary patient organizations in the endocrine and pituitary world for many years, and one of her particular research interests is in endocrinology. And finally, Dr. Jonathan Hayes is a registered dietitian who's had many years of experience working in weight management services in NHS Lothian. In a moment, I'll hand it over to them. And while they're speaking, you'll be able to put your questions to them in the Q&A chat box, which we'll pick up after the three of them have spoken. We have got a lot of people with us tonight, so it might be the case that we don't get round to your question, but if we don't, we'll try to pick up all the questions and put them into a Q&A document, which we'll publish on the project website. So without any more from me, I'll hand you over to Professor Bollaert to talk to you about weight management and thyroid disorders.
Can you see that? Yeah. Okay. So good evening, everyone, and thank you very much for asking me to speak here. So as Julia kindly said, I'm Christine Bollaert, and I'm a professor of endocrinology in Birmingham. So I thought I will, because what I do is being an endocrinologist dealing mainly with patients with thyroid diseases, is talk a little bit about thyroid hormones. And, I'm sure quite a bit of this you already know, but maybe some of you don't fully know or don't fully understand. And I just wanted to give a little bit of background. But so thyroid hormones are what we need to control our metabolism. And it's essentially a balance between energy generation and use. And I think that's what we'll be talking about most tonight, because that's how they affect a lot of our well-being and weight. They also have very crucial roles in growth and development, but that is less of a focus tonight. So thyroid hormones are produced by the thyroid gland, and the thyroid gland produces mainly T4, which is a prohormone. The active thyroid hormone is T3, and I'll show you their structures in a bit just to show the difference. But essentially, T3 is what acts on the target tissues. These red arrows here show how that there is a feedback mechanism to the pituitary gland and the hypothalamus, and that is to keep homeostasis. But importantly, what these thyroid hormones do is that they act on virtually every cell in our body, because we have thyroid receptors in virtually every organ. However, it is usually the cardiovascular, the digestive, and the neurological system that are affected when these hormones are not in balance. So this here shows the structure of T4 and T3, and you can see the difference is that T3 has 3 iodine residues and T4 has 4 iodine residues. As I said, T4 is what's mainly produced by the thyroid gland, but T3 is the biologically active thyroid hormone. And what we have in our peripheral tissues are these enzymes called deiodinase enzymes that will take one of the iodine residues of T4 away to activate it to T3. This whole regulation is a little bit more complex, but I don't think that is the subject of today's discussion. And then the further thing to consider is that thyroid hormones circulate in the blood bound to proteins. For most of this is bound to thyroxine binding globulin, but you can see that the amount of free hormone in the circulation is actually quite significantly less than the amount of total hormone. So what is generally measured by doctors when they measure thyroid hormones are the free concentrations. And so the 3 things that are generally measured or can be measured are serum TSH, serum free T3, and serum free T4. So serum TSH is your pituitary hormone. I showed you that pituitary gland, which really regulates the release of thyroid hormones. And that is actually when a serum TSH is normal, it is very unlikely that a person has thyroid dysfunction. So often in primary care, all that's measured is a serum TSH, because if that's normal, then it's highly unlikely that you have a problem with the thyroid gland. There are, of course, a number of exceptions. If that is abnormal, then measurement of free T4 and or free T3 can be useful. So if you have an overactive thyroid gland, so this, what we're talking about here is a problem with the thyroid gland where there is an excess production of thyroid hormones. You get an increase in the amount of free T3 and free T4. So the thyroid gland is diseased and produces too much of this. And as a consequence, in the negative feedback mechanism, TSH will be low and often undetectable. And the opposite happens in an underactive thyroid gland or hypothyroidism, where there is insufficient production within the thyroid gland, and as a consequence, TSH will be high because the pituitary gland is trying to tell the thyroid gland to make more thyroid hormones. I've said that most of our cells in the body have thyroid receptors, but often the symptoms of an overactive thyroid gland in hyperthyroidism are concentrated on the cardiovascular system and the gastrointestinal system. So, and this is essentially a speeding up of the metabolism. It results in a rapid heart rate, sometimes an irregular heart rate. Most patients will lose weight. Some will have an increased transit to the bowel with some diarrhea, and people can get a number of neurological symptoms. Those with Graves' disease can also have a number of eye symptoms, but again, that is not the subject of today's talk. And symptoms can be widely varied and don't always necessarily go hand in hand with the abnormality of the thyroid function. So I have people who walk into my clinic room and I say, you must be feeling absolutely awful because their thyroid hormone levels are so abnormal. And they say, no, I'm fine. And equally, I have patients whose thyroid function is normal or near normal, and they have multiple symptoms. This is very much certainly for hyperthyroidism age-linked, and what this graph here illustrates, I won't dwell on the details of it, but essentially what we looked at was a large cohort, more than 3,000 patients who had presented with hyperthyroidism. We divided them according to age, and we looked at typical symptoms of an overactive thyroid gland, and you can see that all the people, so that's the lilac bar here, were quite often very asymptomatic. And conversely, those who were very symptomatic were much less likely to be in that older age group. So there is an age link to this. In order to treat an overactive thyroid gland, essentially we have 3 ways of treating it. We can give medication, we can give radioactive iodine, and we can give surgery. So what's given in green here are the advantages, and in red show the disadvantages. I won't dwell too much on this, but what's important to bear in mind here is that 2 of the treatment options that we call definitive treatment options that have a very good chance of curing people are associated with inducing hypothyroidism, and that may well be linked to weight issues. So we know that patients, as I've already said, patients with hypothyroidism often lose weight before they present to us. So in a way, once we make them better by giving any of those three treatments, we sort of expect them to gain weight. And so this is looking at over 1,300 patients who came to our clinic, looking at their weight, and that is regardless of which treatment they underwent. But you can see that most of the weight gain is in the first 6 months, but this is continued for many years after, even if it plateaus off a little bit. And just to illustrate that weight may well be a problem, and this is quite a complicated graph, but essentially what this looks at is men and women when they first present to our clinic and then when they're discharged. And we compared our patients with hypothyroidism, so our diseased population, with the background population. And we found that when they present to our clinic, both men and women are lighter than our background population, unsurprisingly, because people have lost weight. But we also noted that when we discharge them, so when we have restored their thyroid function to normal, they're actually heavier than the background population. So it may not be just regaining of lost weight, there may actually be a little bit of an overshoot. And when we modeled that, you can see here for patients treated with medication, and then, so that's the blue line here. So this is a modeling of an average female patient presenting with an overactive thyroid gland. You can see that if we were to give that patient radioactive iodine, that there would be a slightly increased weight gain. And then if that patient had radioiodine and became hypothyroid, there would be an even more pronounced weight gain. Now, in absolute terms, this difference here only translates to about between 1.2 and 1.7 kilograms. So in the larger scheme of things, not a massive amount. And again, I won't really dwell on this, but the reason why radioactive iodine is often a preferred option is because when you look at long-term outcomes, because you know that an overactive thyroid gland is associated with an increased risk of giving heart disease, that patients who are treated with medication alone have this increased risk of cardiovascular disease, whereas those patients who are made hypothyroid with radioiodine, that is no longer present. And then a further study that was performed in Wales, again showing similar results, that by giving rapid good control with radioactive iodine, you actually get a reduction in the overall mortality risk from cardiovascular disease. On the other side of the spectrum, then hypothyroidism. So this is very much a slowing down of the metabolism, where you can see that, again, it's mainly effects on the heart and on the gastrointestinal system. So often people will have a slow heart rate, they will gain weight, they will be constipated, and they will get this typical puffiness or myxodematous appearance of their face. But with regards to weight, this is often associated with weight gain. And then, of course, we have a number of patients. So the treatment for an underactive thyroid gland is that we give levothyroxine replacement. So the thyroid hormones that people are deficient in, we replace them. Again, here are listed the symptoms typically of hypothyroidism, but there are a number of people who, despite normalizing their thyroid function with levothyroxine replacement, they have typical symptoms of brain fog, weight gain, and excessive tiredness. So very much related to weight management and well-being symptoms that they have. And so part of the problem here is that there is a school of thought that because when we were by the thyroid, comes from T4. About 80% of the T3 that we have is converted from T4, but about 20% is directly produced by the thyroid gland. And if you give levothyroxine replacement, then you do not necessarily replace that 20%. So what we generally do is we give a slightly higher than concentration of T4, but there have been a number of trials that have looked at combining T3 and T4 therapy. And the upshot of these trials, while some have individually shown some benefit, in a number of large systematic reviews have shown that there is no clinical benefit, and that this combination treatment is not beneficial at a population level. However, there is anecdotal evidence that at an individual level, sometimes this may actually result in better well-being. And this graph, again, I won't bore you with this, but this is from one of the systematic reviews showing that there wasn't really an effect on general well-being from giving combination therapy. So I'm sure this was just an introduction to what thyroid hormones do and what happens in disease states, and I'm very happy to answer some of the questions that you may have. So I will stop sharing now and hand over to the next speaker.
So thank you, Christine. Now I'm hoping that Jonathan is going to join us, and he's going to talk about everything from a diet perspective. Hi, Jonathan.
Hi. So good evening, everybody. I'm Jonathan. I'm one of the dietitians that works in the weight management service in NHS Lothian, based in Edinburgh. I haven't got a presentation for you tonight because I just wanted to talk over the next 10 or so minutes about weight loss and the complexities of it. I guess my background being predominantly working in a weight management service is for people wanting to try and lose weight, but I can talk a little bit about trying to gain weight as well. So for those struggling, say, with hyperthyroid conditions, there is, I guess, a lot to cover potentially in 10 minutes. So I was just thinking as I was listening to Christine's presentation about the fact that it's come to the end of January pretty much by tomorrow, and I wonder how many people watching this are or have made those changes like on the 1st of January or the 2nd of January and decided, right, this is the time, this is when I'm going to start. And I wonder how many people actually thought about, you know, why are you wanting to make these changes, either to gain weight or to potentially lose weight? Because typically we see lots of people who will set themselves targets, which might be based on body mass index and looking at or ideal body weight. So I guess I maybe want to flip that on the head and maybe think about when you're wanting to make changes to lose weight or to gain weight is why are you doing it? So when you make that decision to join a gym, make changes to your diet, just using very generic examples there, there's a gym, obviously there are other forms of exercise around, is why are you going to get up every day to go to the gym, or when you plan to go, why are you going to make those conscious decisions around food, whether that's for weight gain or whether that is to aim for weight loss? Because if we don't have a good enough reason, we're probably not likely to continue, especially when the days are hard. And let's face it, January cannot be the nicest of months, really, when we've got the darker weather and the weather's not so nice. You know, it'd be easy to start it in the summer. So I'd say step number one is thinking about, what am I doing this for? And then when you achieve that goal, what's going to keep you going afterwards? So I guess a classic thing we always see is people saying they want to lose weight for an occasion, like it's their daughter's wedding, or they want to lose weight for a holiday. But once you've reached that goal, so say you've achieved some weight loss for that goal or some weight gain, why are you going to keep going once that event has passed? You have no reason to keep going, potentially, if that was your only goal. So all I would say is when you look at your goals, yes, it's good to have short-term ones. It's also good to have long-term ones. So you could take and then when it then comes to then achieving those goals, you are the experts in your own lives. So you are going to know what areas you can make changes for, which is why when you look at all the diets that are out there, yes, a lot of them will help you lose weight. However, it's looking at what one is going to work for you, because there is no one size fits all, which is why generally we as dietitians, we're not that prescriptive in terms of saying, right, eat this for breakfast, lunch and dinner. eat this for snacks and do this Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. We don't, because there are so many factors that will come into play. I guess one that's quite prevalent at the moment is the cost of living crisis. If you look at, say, something that's been quite popular recently, like a ketogenic diet, that's very high protein, high fat. For someone who is struggling financially to afford those kind of foods, they are quite costly, potentially, to say, for the amount of protein and the amount of fat-based foods that you would need to consume. So in the short term, that might be a realistic diet to follow, but in the long term, it might not be. So that's one thing you might want to consider, is the cost of the foods you're going to be looking at if you're going to make changes, the costs of exercise to do as well. There are some exercise and referral schemes potentially from GPs in your local area. It might be worth asking. One exercise that's always free to start off with is walking. And then I guess linked in with that, in terms of the complexity of weight loss as well, is that some people will find, for example, that they don't actually like going to a gym because they feel quite self-conscious. So then they don't exercise, and then maybe something they could do is walking, but they don't think of walking because they feel like they have to go to the gym to lose weight. So, I mean, I was just speaking to someone the other day who found a personal trainer who was offering group-based sessions, and they signed up for this trial. Now, they liked that, so was previously been working and looking at ways to increase their exercise levels, and they really liked that idea because it meant that they were in a group with other people who were there for the same reason, and they didn't feel self-conscious in a gym with what they perceived as their stereotypical image of the stereotypical type of people that would go to the gym that were already quite fit. So they found that solution that works for them. Another example, someone wanted to increase in exercise, was a taxi driver, as a case study, living a very sedentary job, sat down most of the day, 12-hour shifts, had financial concerns because they were self-employed, so finding things difficult, particularly during the pandemic. But they gradually, and taking food with them on the go, so they gradually started to increase their exercise levels, and it was at such a small level that they would lock the doors on the taxi, and then when their fare got to their destination, they would get out and open the door, and that meant they had to go around and open the taxi door. So that was their first sort of way to increase their exercise. Now they're doing park runs, 5K runs, 10K runs. They've also got a supportive partner, so that's other things to consider. The right supportive environment. Have you got a good environment at home that's supportive, whether that's a partner, whether that's children that live with you in the house that are going to support you to make those changes to your weight and to your exercise levels. There's psychological elements to consider as well, which I won't really touch on because we haven't got time, and I'll leave that to Sue, who's coming next after me. There's things you've got to consider, like what's around in your neighborhood as well, and the food environment, and how easy it is to put items in your food basket that maybe you weren't planning on to. I mean, I feel like in this short time that I'm only scratching the surface in weight management, but I would say focus on what your goals are to begin with, keep them in mind, and have them somewhere that you can maybe visualize them, whether it's on your phone or whether it's next to the kettle in the kitchen, where you can see them to help keep you on track, because there will be days where you will find it hard and you may not want to go out for that walk at lunchtime. You may not want to take that lunch that you've prepared into work. So keep going. There are going to be days where you struggle. We all do. But just try to remind yourself why you're doing it and to get back on track. And if you don't, that's fine. You know, be kind to yourself, and hopefully you will get back on track when you can, because life will throw obstacles in the way. There are many stresses that we all experience in life that will make it harder for us to achieve our goals. And I guess the last thing also to consider for those who are trying to gain weight, it's looking at foods that you can add calories to your meals without necessarily increasing the volume. So say, for example, you're having bowls of soup or you're having mashed potato, be adding things like cream and butter. So those are the kind of foods you want to be adding to help increase the calories to make the foods more nutrient dense. So pack a lot more calories in without necessarily increasing the volume, because it can be hard to actually consume a lot more calories if you're trying to increase your weight. But however, as Christine said, hopefully with the medication, the levels should correct themselves. So then your weight should be easier for you to then either gain the weight or to lose the weight. So if anybody's got any questions in the chat that we'll cover at the end, I'm happy to answer more. But I hope you can take a few things out of that chat. But yeah, in the project, there'll be more articles for you to go through, more information on the British Thyroid Foundation website to cover around the area of weight management.
Thank you very much, Jonathan. Great introduction to the topics you're discussing in our weight project so far. I'd now like to introduce you to Dr. Sue Jackson, who's going to talk about a different aspect of weight management. Hi, Sue.
Hello. Yes, indeed. Right, I need to find my slides. There they are. Okay, so hopefully you can see that. I'm focusing on the well-being aspects of what it means to be human, and trying to improve our lives in various ways. I need to find my button to click my thing. Work. There we go. Okay, so yeah, it's complicated being human. There's a lot to it potentially. Jonathan's just been talking about some of the things that you need to think about, but your mind can hold all kinds of information, things that you tell yourself in relation to how you are and how your life is. For some individuals, their appearance changes as a result of their condition, and the extent to which it's changed can have a massive impact in terms of how they see themselves, and also how they think other people are seeing them. There can be impacts on your personality. So we all have a personality, and you might not necessarily like the way sometimes the condition impacts on you. So that whole thing about being really tired and not able to do the things that you would normally do, this kind of, it doesn't feel like who you are and who you should be, and that can also make life difficult for us in terms of how we're feeling about things, what we feel able to do. Feelings, moods and emotions, the tiredness, the fatigue, the brain fog can really bring you down, make you feel really miserable. Some people get concerned that actually it's going to be like that for forever, and it leads to concerns around, will they be able to continue doing their job? And yeah, it not easy, definitely not easy. All of us have a history, we have personal experience. We get part of our sense of ourself comes from this kind of narrative we hold in our head about who we are. Psychologists sometimes talk about how being diagnosed with a significant condition that's causing you significant difficulties can act as what we call a biographical disruption. So you had the story that you were kind of living your life, your personal history, and a diagnosis of something, and it's kind of how it's playing out can influence your expectations about what you think your life will be like going forward. So you might start to have concerns about, will it continue to be like this? Will I never be able to get back to how I was before? And yeah, that then adds into the mood and emotions and so on. In terms of spirituality, in the sense that we often mean it, this isn't about religion. This is about the extent to which people believe that there is some other way of, or some other explanation, if you like, for the universe. It may contain an element of religion, it may not. We all vary in the extent to which it matters to us. Some people it's hugely important, for others it's really not. And then obviously there's your body. Your body primarily is the thing in which your consciousness kind of navigates its world. It provides you with lots of sensation, but unfortunately it also provides you with symptoms of the condition that you have. And so all of this together, it's a lot to have to bear in mind. I'm pretty sure if I asked you to vote, a lot of you would say that a lot of these things of what it means to be human have been affected or are being affected by your condition. You may also feel that other people don't necessarily understand the extent to which it's affecting you. And you may also, some of you feel that the healthcare professionals that you're dealing with, some of them might seem to understand more than others. It can be a very frustrating experience trying to communicate how you're feeling and what you need. So in relation to defining well-being, which is the other component of what we're talking about tonight, so this is weight management and well-being. Well-being is broadly defined as the state of being comfortable, healthy or happy. And physical health is considered a key element of well-being, particularly by the Department for Health. Physical health is one of the key domains that's measured by the Office for National Statistics, and they give reports to the government and produce reports about the physical health of the nation. However, its relationship with well-being is interesting because not everyone who reports their physical health as being good or very good has high levels of life satisfaction. So while it's important, it's not necessarily the key determinant of your level of well-being. And not everyone who reports their physical health as being bad or very bad has low levels of life satisfaction. And it's not just in relation to well-being. We see the same pattern in relation to things like the extent to which people feel happy, or feel anxious, or feel that their life is worthwhile. And so in essence, what that means is while your physical health matters, of course it matters, it doesn't actually have to determine your sense of well-being, which I feel very cheered by on certain days when my own health condition is making life difficult. So your relationship with your condition, we've got good days and bad days. The bad days are on the left when it feels like your condition dominates everything that it means to be about your life. And that's not generally how people want to live their lives. When I work with clients, what they actually want is for the management of their condition, whatever it is, to become almost routine. It's something that they do, but it's not the main focus of their life. It's very frustrating if you have a chronic health condition, because when it's playing up, when you're having difficult times, you can want to have a break from it. But the reality of living with a chronic health condition is that you don't get a break from it. The best you can hope for is that it does kind of take its place as one of the things that you have to attend to, but hopefully it's not something that's dominating. The problem that you can have is if your condition is limiting you in terms of you're experiencing lots of brain fog, or you're really struggling with the fatigue and you're finding it really hard to do activities of daily living and such, that can really impact on your self-esteem. So your self-esteem is the relationship you have with yourself. If that isn't good, if the voice in your head is very highly critical of you, that can help prevent you from being able to live a better quality life, if you like. So what I mean by that is we can have this voice in our head that tells us you can't do certain things until you're a particular weight, or until you've dealt with X issue, or whatever it might be. It's almost as though it's telling you you can't live the life you want to live until you've earned it, until you've got down to the required amount of weight, or whatever it might be, whatever it is that you're your relationship with yourself demands in order for you to be around other people and feel like they're not paying attention to you, they're not judging you, they're not being critical of you. And that can be problematic and difficult for individuals. I fully recognise how hard that can be in terms of managing how you want to live your life. And like Jonathan said, it's not it's about thinking about what it is you want to do and why do you want to do it. So I liken it to calling a taxi. If you're going to make a change, you need to have some idea where you're starting from. You can't just dial a number for a taxi firm and say, come and get me. You've actually got to tell them where you are. And if you're wanting to make any kind of change, you've got to know where you're starting from. Part of the problem with being human is an awful lot of what we do, a lot of our behaviour is habitual. Habits, by definition, if you're a psychologist at any rate, are unconscious behaviours. You're not necessarily consciously aware of the habits and things that you've got into doing. And so you need to spend potentially a bit of time getting to understand yourself. And it's something you may need to revisit as you go through the process of change. So you need to know where you're starting from. It also helps if you've got some idea about where you want to get to. What kind of life do you want to be living? And like Jonathan was saying, you need a mix of goals. You need some short-term things that you need to get to, but you may also need some longer-term things in terms of things that you want to aim at. And then you'll need to work out, once you know where A and B are, you need to work out the route, the methods, the steps that you need to take that will get you from A to B. Okay, so you can't call a taxi and say, I don't want to be here. You've actually got to have some idea about what it is you're wanting to achieve. So in terms of well-being, we actually define that in a variety of ways. So this is glory's in the name of the 8 dimensions of wellness, because there are 8 different areas in which potentially you might want to focus your efforts. So the top one, which is slightly obscured on my screen, but hopefully you can see it, is the emotional wellness domain. That's about coping effectively with life and having satisfying relationships. Then we've got financial domain, social dimension, very important, that sense of connection, belonging, well-developed support system. Spiritual, I already talked about, our sense of purpose and meaning in life. Occupational domain or dimension. Physical, it's one of many. So this is why this is kind of taking it broader. Physical activity, diet, sleep, nutrition is one aspect. There are all these other ones as well. Intellectual, which is my pet area of wellness, that recognizing creative abilities and finding ways to expand knowledge and skills. I'm a big fan of lifelong learning because it's just so good for your self-esteem and your self-confidence and your well-being generally. And environmental, so having or living in an environment that's suitable for you. A few years ago, I was running a program at the University of West of England, and one of the things we were looking at was how do people do behaviour change. We used to run a program where people would have to sign up to make a behaviour change over a period of weeks. And then at the end of the course, they then had to tell us what they did, how long it lasted for, what kinds of techniques that we were teaching them on the course did they use to help them to stick to their goal. What was interesting was the group sort of divided themselves into 2 halves. We had half who were doing the things you ought to do. So it was looking at diet, looking at physical activity, drinking more water, not smoking, those kinds of things. We had another group who chose to focus on some other aspects of wellness. So it could have been about improving a relationship with family, or improving family time, the amount of family time a particular family got. It could be about someone wanted to take up dancing again, but not from doing it as a physical activity point of view. They just wanted to explore different kinds of dancing and find out which one kind of best expressed them creatively, which is different to the physical exercise component. What was really interesting was that by the time we got to the end of the course and the trainees were talking to us about what happened, the individuals who had chosen the kind of more the other dimensions of wellness. So we had somebody who looked at improving their time management, making themselves more organized, that kind of thing. There are people who were working on their relationships and such. What was interesting was they actually worked at those goals for much longer. They put much more effort into them. And what was also interesting was the side effect of them was that quite often, because they were feeling happier with themselves, they weren't doing so much of what we call the negative coping habits. So that would mean they weren't eating junk food, or they weren't smoking, etc. So the things that the AUTS group were doing, those changes happened in this other group that had focused on some other dimension of wellness, and it happened as a side effect of being happier with themselves generally. So it's almost like I was saying earlier, some people put their life on hold and kind of say, oh, I can't do that because I haven't earned it. Half of our group basically said, I want to do these things regardless, and then had the benefit, the knock-on effect of improved physical activity, diet, etc., because they weren't doing the dodgy coping strategies that potentially they might have done before. The other thing that's really beneficial in terms of keeping things in balance is when things are really tough and really difficult, actually acknowledging that there are still some things in your life that are going okay, and when things are going well, actually acknowledging that those things are there as well. There are all kinds of gratitude lists and things that you can use. You can, if you look it up online, you'll find loads of them. This one is particularly interesting. So who or what inspired you today? If you're wanting to keep your goals going, you need some kind of inspiration, some kind of motivation. That is a really interesting thing to reflect on and kind of think about who or what inspires you day by day. Comfort. So remember, part of well-being is feeling comfortable. So who or what brought you comfort today? And that's also an interesting thing to reflect on. The answer may be surprising. And who or what brought you joy today? Now, that may not be a belly laugh, but it could be all the little things that you just enjoyed that were scattered through your day, like the smell of coffee or the cat washing his ears or whatever it might be. So those things are part of the thing that Jonathan was talking about in terms of helping you keep your motivation going. And there endeth my spiel for today. So there you go, as it says under the daffodils. Thank you for listening. And now I'll take my slides down. There we go.
Thank you very much, Sue. It's lovely hearing you speak. If anybody who hasn't seen our project yet, you can go and get a weekly video from Sue. So she gives lots of top tips about managing your well-being on our project website. So we've got lots of questions have come in. Quite a lot of the questions aren't necessarily weight related. So I'll try to cover the others first because it's more relevant to the topic we're covering tonight. So let me see. First of all, and this is something I often get asked, we're talking generally about people with thyroid disorders. Do the comments that each of you've got, particularly I suppose with regard to you, Christine, do they relate as much to people with hypo and hyperthyroidism, and is it people with and without a thyroid? So of course a lot of people tell us they haven't got a thyroid anymore, so does this information still apply to them?
Yeah, I saw that question. So that's a good question. So most patients with thyroid cancer will have at least part, if not their whole thyroid removed, and then have had radioactive iodine. And so the question is, is that hypothyroidism associated with the same issues as the hypothyroidism you get from generally what in the Western world will most commonly be an autoimmune condition? And I think the answer is yes. So, I certainly look after quite a few patients who've had their thyroid removed because of cancer, where there are issues with thyroid replacement, impacts on well-being, impacts on weight. I think there is, and we don't quite know this, there is something that the autoimmunity per se may play a role in those patients who have autoimmune thyroid disease. Of course, patients who have a cancer diagnosis have then a further impact on their well-being in that they have to live with a cancer diagnosis. So all these things are often multifactorial, but I think the short answer is yes. The issues apply, issues around hypothyroidism. So hyperthyroidism is less relevant there, but hypothyroidism, having a total thyroid removed, probably needing slightly more thyroxine because well, you don't have a thyroid to produce any, and then in some patients who have sort of the more aggressive form of cancer, sometimes we actually have to overtreat and actually make them slightly hyperthyroid. So the whole gamut of symptoms and issues, I think, does also apply.
Thank you. I think you also covered the point about autoimmune disease. Somebody else was asking about whether it's any different for people who got autoimmune Hashimoto's thyroiditis. For anybody who's interested in learning more about the field of autoimmunity, you can there's some articles by Professor Marion Ludgate in the expert section, or the medical experts section of the project website, where she talks about the gut biome and some really interesting research there. Jonathan, it's something for you. I think you also are aware of exercise as well. I know you do diet, but weight management services, you deal with exercise as well. Is it okay for people to do cardio exercise and when they've got hypothyroidism?
I did see the question on exercise. Unfortunately, Julie, I'm going to have to say I'm not actually qualified in exercise. I can only stick to I guess in terms of regulations, in terms of advising on general exercise advice, around 150 minutes of physical activity, but I'd say stressing the importance of getting some resistance-based exercise in there. I'm not sure if there's any, I'm not sure if it was maybe more of a medical focus around doing the cardio exercise and its effects with having a thyroid condition. I'm not sure.
Christine?
Yeah, so my advice to patients usually is that, because many of these patients are young and have a good heart, I think if they have significant coexisting heart disease, then, I would be a little bit cautious with exercise, especially when there is this drive of having high levels of thyroid hormones, which particularly puts a stress on the heart. But often what in my spiel to patients is, your body will tell you. If you're on the treadmill and your body tells you this is enough, or if your heart rate goes up so fast, then I think you should stop. But by and large, exercise is good, as we've all already heard, everything in moderation. And I think everything that your body tells you can and can't do generally is allowed, unless if you have an irregular heartbeat or a coexisting heart condition, then I would probably be a little bit more cautious.
Yeah, so be sensible and listen to your body is always good advice, isn't it? We've had a few questions come through about thyroid and menopause and perimenopause and HRT and levothyroxine. Christine, could you give us some thoughts about how they interact with weight gain?
Yeah, so they're very good questions. And we know, of course, that with aging, we gain weight. So as we age, we gain weight. Women who become menopausal gain weight regardless of whether they have a thyroid problem. So is that a compounded issue? Yes, it is. The further issue then is people going on HRT, or people who are already on HRT, if they then become hypothyroid, the HRT or people who have hypothyroidism and go on HRT can interfere with the metabolism of thyroxine, and therefore the dose may have to be adjusted. So we may have to do more regular thyroid function testing. But so yes, aging, becoming menopausal, getting thyroid problems, they all sort of compound each other and make it difficult. But it's about regular thyroid function testing. And because I think, again, I saw this come up on a few occasions, I think very much what we need to do is individualized decision-making for patients, because we all, and I think that answers one of the other questions, we all have our own set point of thyroid. So what's normal for me, my 3T4, is going to be different to Julia's, is going to be different to Sue's, is going to be different to Jonathan. And often when people come with an underactive thyroid gland, we don't, because they would have never had a thyroid function test, we don't know what their pre-existing one was. But a bit of fine tuning, even with the TSH within the normal reference range, I think is quite acceptable. And certainly the NICE guidelines do recommend that those patients who continue to feel unwell, that some fine tuning within the reference range is required. And I do spend a lot of my time doing that. And again, in people who are menopausal, who are on HRT, where there's changes in other hormones, some further adjustments may have to be made.
Thank you, Christine.
Sorry, Julia,
George,
could
yes.
I add, because I was reading some of the questions as well, just to add to that, Christine, just because I think it was one of the questions around normal levels. And I'd say in weight management, you do get a few patients who say, well, my GP says I'm within the normal range, but I'm still feeling some of the symptoms of my thyroid condition. So like you said, you don't necessarily have that, you know, what were they pre-thyroid condition to refer to? So how do those patients manage that when they're speaking to GPs and other medical professionals?
Yeah, so I mean, like I said, the NICE guidelines do say that if a patient is on levothyroxine replacement, has normal thyroid function, but still feels unwell, that, you know, because sometimes this is all based on a simple TSH measurement, that measuring a free T4, first of all, measuring a free T4 may be helpful. And then that fine tuning of levothyroxine within the, you know, keeping TSH within a normal reference range is helpful. And so it's a bit of trial and error. And like I said, I spend a lot of my time there. I do believe that, of course, thyroid function tests have a value and they tell me a lot, but I don't believe that, well, your thyroid function is normal, you should be feeling normal, don't hassle me anymore, is the right attitude either.
Yeah, I think we would all agree with that as well. Jonathan, there's some thyroid diets, or sorry, some diet-specific type questions. I wonder if you could talk to us about them. Would you recommend a gluten-free or a celiac diet? And there's also another question about intermittent fasting and time-limited eating. What are your thoughts about these different types of diets which we read about?
I mean, I guess if you look at it, the only reason you would want to go on I mean, there is evidence around some gluten-free diets. I'd say in terms of evidence, a lot, some people, I think there's some athletes that are trying it out and it says it works for them. But really, gluten doesn't really hold much nutritional value. It's more in the property and how it reacts with the food to make it, you know, your bread nice and doughy. So unless you have celiac disease, there would be no real reason, or a gluten intolerance, there'd be no real reason to go on a gluten-free diet. But because it doesn't really provide that much nutritional content, I mean, if someone wanted to try it and they wanted to experience it to see if it would help with their thyroid conditions, then there's probably no harm in trying it, as long as they're maybe going for, if they do replace them with fairly similar foods. So, and then, but if they were concerned that maybe they were having symptoms associated with eating gluten-containing foods, I would also ensure that they're going to their GP first, just to have that test, to make sure that they haven't actually, to rule out celiac disease. So I can always look that up and come back to that one, because I haven't specifically come across that question around gluten-free and celiac in relation to thyroid disease. In terms of then intermittent fasting and time-restricted eating, that's the kind of hot topics at the moment. It's interesting, like with all the diets that come along, intermittent fasting seems to be one of the ones that stays there, that has been managing to sort of stay the course. Again, it's like I said back when we were chatting, it's looking at what works for you and can you sustain it. So I've had patients that can sustain the intermittent fasting and it works for them and they love it, and we're happy to support them if that works for them. But then some can only do it for a few months and they go back to what they're doing before and the weight comes back on. So that's my general advice around that, is find something that works for you. And then can you sustain it. In terms of the time restricted eating, so did read an article recently, there is emerging evidence around that, but it's still quite limited at the moment. But if you are restricting yourself to a certain time window, then yes, you probably do eliminate the possibility of eating more than you normally would do.
Yeah, and on the project website, there were several articles that cover these different types of diets, different ways of eating. So you'll be able to access them as we go through the 12 weeks. Sue, I just wondered whether there's anything you wanted to, there don't seem to be any specific questions addressed about well-being. Is there anything you'd like to chip in at this point to comment on the questions you're seeing and anybody else has answered?
Around the time limited eating, that's an interesting one because it's something that comes up a lot on the sleep program that I run. For some people, they seem to get on with it better because it gives their gut time to recover from what they've eaten during the day. And what it seems to do for some people is to help them not get so anxious at night. So some individuals experience a peak in their anxiety in the early hours of the morning. And for some people, again, it's anecdotal, but there seems to be some benefit in doing time restricted eating, just simply because it helps them to be able to sleep through better or not have the peak in the anxiety in the early hours. It's another one of those areas where there's kind of more research needed. There is actually a question for me. I've just realized there's one that's appeared down the very bottom. Question number 46. It says, what would I put in place to deal with the brain fog and tiredness around 4 p.m. When I'm at work, which is difficult and miserable, to say the least. And yes, it is about, what I would say is you won't be the only person. We all of us have a body clock, and our energy levels fluctuate during the day. That's normal. The further you get away from, the more time elapses since you got up in the morning, you're going to have your energy dip. And yes, for individuals who've got thyroid condition, the dip can feel very significant. In terms of managing it, there are some things that you can do. And on the sleep program, we look at ways that you can not exactly fake it, but ways that you can help clear your head. So for instance, I can't stand drinking mint tea. Honestly, it's not a happy experience, but smelling it, mint actually helps to clear your head. And having mint tea on the desk so that the steam rises and I get the benefit of the smell of it. Actually, that can be really beneficial in terms of helping to clear your head and give you a sense that you've got a bit more energy. It's those kinds of things. It's kind of working on those things that will actually help to clear your head a bit. In the afternoon as well, if that's when you struggle the most, if you have the control, to be able to switch to things that are less demanding in the afternoon. So one of the things I have to do is switch to, I can't do coherent writing in an afternoon. My energy levels just aren't there for me to be able to concentrate long enough, but I can do other things. And so I do other things. So I try and arrange my day so that as my energy falls, I've actually got stuff that I can do that's useful contribution to my working life and to my colleagues. So I'm not driving them crazy. But I that's what I have to do. I can't do everything all the time. I could when I was younger, but I can't anymore. It's just, and that's a reality. And yeah, I've had to learn how not to be embarrassed about it and just say, I need, cut me some slack, guys, which isn't easy. I do appreciate it's not easy.
Thank you, Sue. I particularly like your tip about mint, and I think you advise us to get some peppermint essence, and I sometimes waft that around in the afternoon, and it's pretty good for clearing my head. I like that. Christine, and I think we're going to have to tidy up soon, but I finish up soon. Christine, there's a question for you, a couple of questions I think you might be able to help with. Is there a role, or what is the role for T3 liothyronine with weight loss, and is there any research about benefits of combination therapy and weight?
Yeah, so there is some research. Now, I just want to emphasize, neither T4 nor T3 are weight loss drugs. Okay, they help us restore thyroid function to normal. Neither of them are weight loss drugs, nor should they be used as that. So the whole T4 debate is an ongoing debate. The issue is that we don't really have a good T3 preparation, and that's certainly what's in development. And I know there's a number of exciting trials that are going to come on board looking at longer acting T3 preparations, which are going to help. I think, assuming they're safe and successful. So Do I prescribe T3 for weight loss? No, because like I said, these are not weight loss drugs. I think a trial of T3 and T4 in certain people. So what I do if someone comes to me and has an underactive thyroid, is hypothyroid, has been established on levothyroxine, has normal thyroid function, is first of all, like I said, tweak it within the normal range. And many people actually, you know, when the TSH is sort of towards the higher end of normal, when we actually bring that lower and presumably get them more around their own set point, they start feeling better. There is some RMOC guidance that in selected patients, we can give a trial of T3, T4 combination. I must say that for the majority of patients that doesn't work, even if they have a honeymoon period, it doesn't give a lasting effect. Many people get abnormal thyroid function with a suppressed TSH, which certainly is not good for long-term health. So it's certainly not the answer to everything. It's not a weight loss drug, but some of the studies that have looked at it, and indeed, if you take T3 that's sufficient to actually make your thyroid function abnormal and slightly overactive, then I think you may well lose weight. However, that is not the way to lose weight. You know, I think it's about having a balanced diet and healthy exercise. That is more important, and I think that's very much by this program what we're trying to emphasize here.
Thank you. It's really sad to see the number of comments there are about people who feel very unsupported. And it's very sad, but there isn't a lot of support out there, and there certainly isn't for thyroid patients. That we know the NHS is really stretched, and there isn't a vast amount of evidence about thyroid and weight management. But that's why we put this program together, to see if by bringing the combined brains of all these experts from all these different fields can help you. So please, if you have the opportunity and you like to follow this program and see how it helps you, and you'll hear lots of their tips, you'll learn more about your thyroid, and hopefully you'll also feel supported by the thyroid community while you're here as well. So thank you ever so much to all of you for your presentations. I'll see if I can get my screen back so I can show you the links again. There it is. There we are. There were some really, really interesting questions as well. We didn't cover everything, but I think we covered most of the themes anyway. So what we'll do is we will pull them together as some Q&As that we'll share on the Facebook group for the project. And so if you just be patient, we'll get them out for you so you can all benefit from seeing the questions. The webinar will be has been recorded, and it will be available to watch on YouTube, hopefully from tomorrow, and through our website. So please take a look again if you want to go back over anything, and forward it to anybody else who might be interested. If you haven't already joined our weight loss and wellbeing project, it's not too late. The link is on the screen now, I think. Yeah, the link is on the screen now, and you can just easily sign up. It's free. It's a 12-week program, and we'd love to know how you get on with it, because your feedback will really help us and enable us to keep it going in the future, and tweaking it if necessary to help thyroid patients, and to share it with doctors so they have a better understanding of what helps their patients. And finally, we're a small charity, so we rely on fundraising and donations. So if you're able to support us, you'd be very welcome to join us as a member. You can join from as little as £19 a year, or make any small donation. Any contribution would be really greatly welcome. So thank you once again. Thank you to our wonderful speakers. They're all very busy people, so we're very grateful that they've given up their time for us tonight. And a special thanks as well to all of you who joined the webinar and asked such interesting questions. Please stay in touch with the BTF, and we look forward to seeing you at future events. Thank you and good night.